There's several classes of dopamine receptors. The older agents only hit one. Atypical antipsychotics block a much broader group of dopamine receptors. That and the fact that they also hit some serotonin receptors gives them not only anti-manic activity, but also some antidepressant activity in many cases. Atypical antipsychotics are available variably as tablets or capsules, taken either once a day or twice a day. Oftentimes, if they have sedating properties, they're taken at night. Some of the medications in this class are also available as long-term depot injections, which allow them to be taken once for a month. When we talk about side effects, it's not uncommon for people to have some muscle stiffness or tremor. Sometimes it's self-limiting. Sometimes an addition of another medication can control that symptom. Other times it becomes more serious and an indication that you need to stop the medication. You can have sedation. Sometimes it's self-limiting. It can often be dealt with by a change in dose or a change in the timing of the medication. Another common set of side effects that happens over time is weight gain and changes in metabolism. That also can be self-limiting, but it needs to be monitored. Sometimes you can add a medication or use diet and exercise to control it. Other times you need to switch to a different medication. Along with monitoring weight, you have to monitor lipid profile and blood glucose. Sexual side effects, often either medication timing or a medication change, can alleviate that. A couple rare but serious side effects would be if you have abnormal movements in your eyes, and that's a medical emergency that you need to let your doctor know about right away or else go to an ER. It's rare, but it can happen. Another is if you have really severe muscle stiffness with fever and confusion. That's also an emergency, and if you can't get in touch with your treatment team, you need to go right to the ER. It can be a good idea to avoid alcohol because alcohol can change the way the drug is metabolized. Alcohol can affect your sleep in unpredictable ways. We always talk about the idea that sleep quality is pretty important if you have bipolar 1. In the early going, it's good to let your treatment team know what's going on. And, they may tell you, that's okay, don't worry about it, we'll just watch this a little more. But sometimes you need to make adjustments in the early going.